nutrients.
Yes.
And also detoxification and drug metabolism.
Yes. Proteins, fatty acids, glucose, all these are metabolized. Glycogen are metabolized in the liver, so there will be derangement of metabolism of all these material. Also decrease in metabolism of circulating hormones like estrogen, and also accumulation of what? Jaundice is the result of what? Decrease in the hepatic ability to metabolize and excrete bilirubin. صحيح? This will result in increase in the unconjugated bilirubin in the blood. بس احنا كلنا دا نحكي physiology and derangement of normal physiology شباب. كنا decrease in protein production, especially albumin, derangement in metabolism of carbohydrate, protein, and fatty acids also. Decrease in the hepatic ability of metabolism of bilirubin, excretion, metabolism, excretion, and also another function is that is impaired, or another functions of hepatocytes. ليش يصير عندهم bleeding؟ اللي عندهم hepatic failure ليش يصير عندهم bleeding شباب؟ What is the cause of bleeding? What is the cause of?
Because coagulative factors are produced in coagulative protein are produced in liver.
Exactly. Coagulation factors are produced by the hepatocytes. So in hepatic failure or hepatic insult, there is increase in bruising, increase in bleeding due to decrease in the level of coagulation factor production. Exactly. But another function, another material that is impaired in metabolism, ammonia. What about ammonia? That is nitrogen-related substance. It will be accumulated in liver failure or impaired liver function. What is the effect of ammonia? Mainly systemically, mainly affect the brain, result in brain edema, and the patient develop what we call it cerebral functional impairment or hepatic encephalopathy. المهم, all the functions or the normal physiological functions of the liver are impaired in liver diseases, whatever the disease, and according to the severity and according to the time, according to the whether it is acute or chronic, and so on. Put in mind that is hepatic impairment or hepatic failure signs are derangement or impairment of normal physiology of the liver cells. Okay. There are patterns or certain morphological types of hepatocellular injury. Certain types or specific types of hepatocellular injury, cellular injuries to the hepatocytes specifically seen in these cells. Number one, degeneration and intracellular accumulation, necrosis and apoptosis are specific. So, degeneration and intracellular accumulation. Ballooning degeneration in which there is swelling and edema of the hepatocytes with the clumping of the cytoplasm. This is following toxic, drug-induced or immunological insult or viral infection. But ballooning degeneration. This is the pattern of, or the morphological or microscopical appearance of ballooned hepatocytes. The cells are swollen, edematous, and with cytoplasmic clumping. Foamy degeneration. Foamy degeneration. This is also in which there is here or foamy or feathery degeneration. feathery يعني مثل الريش. Feathery degeneration. Again, there is swelling and edema of the hepatocytes with clumping or retaining of biliary material or biliary secretion, bile. So bile is seen within the cells and intracellular and extracellular accumulation of bile. So the brownish material here is bile accumulation, feathery degeneration or foamy degeneration, biliary material accumulation. Steatosis, any idea what is steatosis شباب؟ شنو الاسم الآخر للsteatosis؟ ماخذيه سابقا انتم بالcell injury. What is steatosis? Steatosis احنا اخذنا steatorrhea بالمال absorption بالceliac disease. Steatorrhea مو صحيح؟ Steatosis, what is steatosis? The other name of steatosis is
fatty change.
Fatty change, exactly. Fatty change or fatty degeneration. Accumulation of fat droplet within the hepatocytes, whether micro من اسمها microvesicular يعني small vesicles or vacuoles within the cytoplasm, tiny vesicles, or macrovesicular. Here macrovesicular نشوفها. This is the microvesicular, small, tiny hepatocellular fatty change or fatty vacuoles within the hepatocytes, within the cytoplasm, or this is the macrovesicular, large, single large vacuole, fatty vacuole within the hepatocyte that displaces the nucleus to one side. Okay. Steatosis, so micro or macrovesicular, and deposition of iron and copper. This can be seen in certain disorders, hemochromatosis, deposition of iron and copper in Wilson disease. Hemochromatosis, whether primary or secondary. نجي عليها بالمحاضرة القادمة إن شاء الله. So ballooning degeneration or ballooned hepatocytes, this is not specific. It can be seen in drug injury or insult or toxic injury. It can be seen in drug-induced hepatitis, or can be seen also in viral hepatitis or any type. Other type, this is the ballooning again. Ballooning, degeneration, swelling, and edema of the hepatocytes and Castleman bodies. These are Castleman bodies, clumped or shrunken, pycnotic hepatocytes that are seen اللي هو إذا سامعين بالapoptosis, which is a selective or programmed cell death. So in liver biopsy with injury, selective or scattered apoptotic hepatocytes can be seen, called Castleman bodies. Feathery degeneration, accumulation of biliary material within a swollen hepatocytes. Necrosis and apoptosis, another pattern or special type. Ischemic coagulative necrosis as a type of coagulative necrosis seen with lysis of the nucleus and dense cytoplasm. Castleman bodies also are, as I say, they are scattered apoptotic hepatocytes as a result of toxic or immunological or viral or even alcoholic liver disease or toxic liver injury. Lytic necrosis, in which the hepatocytes are will be are swollen and ruptured as a result of swelling and edema. It will be ruptured, called lytic necrosis. The centrilobular necrosis, as I say, the hepatocytes around the central vein are the first to be necrotized or to be affected by toxic insult and hypoxia, especially in ischemia or drug-induced hepatitis, and again any toxic reaction. Apoptosis, this is the what we call it. شو نسمينا هذا شباب بالapoptosis?
Castleman body.
Exactly. Fatty liver. The normal appearance or normal color of the liver is dark red. Here it is transformed into orange or yellow with greasy texture. Shabab, is fatty, any idea about fatty change or fatty liver? Is it reversible or irreversible change? Please.
It's irreversible.
Irreversible.
Reversible or irreversible?
Irreversible.
لا, reversible. Fatty change is a reversible process or cell change. Okay. مثل ما قلنا microvesicular within the cytoplasm, small vesicles و macrovesicular. وخلوا بالكم هذه the three main causes of fatty change or steatosis. It can be silent, and the main causes are three: obesity, diabetes, and toxic. Toxic يعني نقصد بها أول شيء شنو؟ يجي للبال يخطر على بالكم دراج، وبعد شنو قبل الدراج شباب؟ obesity, diabetes, and toxic.
الكحول.
Yes, exactly. Alcoholic liver disease is the main cause of fatty change. Macrovesicular نقصد بها large vacuole, lipid vacuole displacing the nucleus to one side. Patterns of necrosis حسب الاريا، حسب السيفيريتي، حسب الديوريشن of injury, of insult, according to the immunological status of the patient. يعني مثلا mid-zonal and periportal. mid-zonal mean in zone. يا zone هذه mid-zonal من اسمها شباب. mid-zonal mean necrosis in zone 2. mid-zonal يعني mid-zonal بالنص يعني. zone 2 أدري zone 2 and periportal necrosis. periportal هي zone 1 وmid-zonal zone 2. Rare periportal occurring in eclampsia and pregnancy. This is hepatic injury in pregnant women can be severe and can be acute because of lowered immunity in pregnant female. Focal necrosis, this is less severe, limited to the interface between periportal parenchyma and inflamed portal tract. Focal necrosis, this is mild من اسمه focal. Bridging necrosis and severe inflammatory necrosis between adjacent hepatocytes and adjacent portal tract. Bridging يعني شو نقصد bridging necrosis يعني هسه هذا مو هو البورتال area or portal tracts شباب. هذه bridging من نقول bridging necrosis نقول portal necrosis, portal central necrosis. واضح؟ يعني necrosis of these hepatocytes هذا نسميه bridging necrosis. portal bridging necrosis. portal central bridging necrosis. واضح؟
دكتور.
نعم.
ممكن نكروسس يصير بالزون زون 2 قبل ما يصير بالزون 3، لو أول شيء يبدأ بالزون 3 لو مو شرط.
قلنا احنا هذا يصير بالpregnant women ورير but the most common site and earlier site to be necrotized هو zone 3 اللي هو central lobular around the central vein because the blood supply الاتجاه مال blood supply شوفوا هذا الاتجاه. This is the direction of blood supply from the portal to the central portal area to the central vein. واضح؟
يعني دكتورة قصدي
أي.
النكروسس دائما أول شيء يبدأ بالزون 3 بعدين يتحول على زون 2 لو مو شرط
لا.
يجوز مثلا.
Yes, exactly. According to the severity, according to the duration of toxicity. زين بس هو أول شيء يبدأ central lobular بعدين يروح يصير زون 3 وياها بعدين نسميه pan lobular كل اللوبيول. واضح؟ أوكي؟
واضح دكتورة.
نعم. زين bridging هسه فهمناكم شنو bridging between two portal areas or between central and portal areas. Submassive necrosis, the entire lobule or panlobular or submassive necrosis. Massive necrosis in which most of the liver is destructed or necrotized. This is associated with acute liver failure. واضح because of massive liver necrosis. Macroscopic abscesses, this is a collection of pus or localized collection of pus disseminated either from the portal through the portal circulation from the GIT or any focus in the body. Can be bacterial or fungal infection, collection of pus within the liver. Inflammation to the hepatocytes can be acute or chronic, called hepatitis, whether it is viral, whether it is drug-induced, whether it is autoimmune hepatitis, and so on. نجي عليه بالتفصيل. And regeneration. شباب, what is the type of hepatocytes in general؟ من نقول types of cells ما أخذتوها بالهيستولوجي بالbiology types of cells. In general types of body cells.
بتاعتي واحد.
Yes. According to the regeneration. لا دقيق العفو اسمح لي. According to the regeneration and replication يعني regeneration. عندك فكرة لو ما عندك؟ Labile cells are cells that are continuously regenerating, like squamous epithelium of the skin, like the columnar epithelium, squamous epithelium lining the GIT. مو صحيح؟ esophagus, oral cavity, stomach, intestine. هذه شنو cells؟ شنو نسميها؟ نسميها labile cells. They are continuously regenerating. مو صحيح؟ The whole thickness مثلا of the skin is كل ال thickness of the skin is or of the epidermis is replaced through 1 month. مو صحيح؟ According to the trauma, according to the friction وهكذا. زين. Hepatocytes are type of cell that are stable cells. هسه ذيك قلنا عليها labile cells. مو صحيح شباب؟ labile cells. Stable cells. What are the stable cells? That are regenerate or divide on need. مو صحيح؟ Whenever there is a need, like مثل شنو؟ like the endothelial cells. مو صحيح؟ Endothelial cells are replicating or regenerating whenever there is a skin wound, for example. مو صحيح؟ and granulation tissue formation. Hepatocytes are also stable cells that have the ability to divide after injury or after damage. ومن البيرمننت سيلز اكو بعد تايب الاخر permanent cells.
نعرف دكتورة.
Exactly. Neurons are that type of permanent cells that have no ability to regenerate. So neuronal loss is permanent loss. Okay. Fibrosis is an irreversible. من يصير fibrosis قلنا الفات change is reversible. Whereas fibrosis, or it is the start of cirrhosis, it is an irreversible process. من يصير scarring مثل الwound. من يصير scarring, من يصير fibrosis, من يصير laying down of fibrous tissue in the sinusoids within the lobule. This is an irreversible one-way process. And there are certain inflammatory cytokines. What is the fact? What are the factors that are induce fibrosis? There are certain inflammatory cytokines that stimulate fibroblastic proliferation and laying down of collagen after any injury. Viral hepatitis, toxic hepatitis, autoimmune, alcoholic-induced liver disease, and so on. Cirrhosis is the end stage. End stage is an... Yes. تفضل. The fibrosis is the action of or activation of fibroblastic reaction. Fibroblast laying down of collagen is a stimulation by the inflammatory cytokines to stimulate هاي اللي سميناها الإيتو cells اللي هي vitamin A storing cells will be transformed into fibroblast, myofibroblast like cells and lay excess amount of collagen and produces fibrosis. هسه نجي عليها بالديتيلز بالcirrhosis إن شاء الله. The cirrhosis is the end stage or irreversible stage of many liver diseases that are irreversible, can be silent at the start, and anything which chronically damages the liver, like viral hepatitis, especially B and C أكثر بالدرجة الأولى, alcoholic liver disease, diabetes, and alcoholic liver disease, certain congenital or hereditary metabolic disorders, hemochromatosis, Wilson's disease, and so on. Cirrhosis, there will be distortion or disruption or of the normal hexagonal lobules by regenerating nodules. اللي هسه نجي عليه بالتفصيل أشوف لكم إياه إن شاء الله. So these are types of previously mentioned types of hepatocellular injury should be put in mind. Sometimes they are specific, sometimes they are general in many sorts of hepatic injury. Viral hepatitis. As you know, or in general, there are certain types or of viruses that can infect the liver in a systemic viral infection, like or the liver can be infected in certain non-specific viruses مثل infectious mononucleosis, Epstein-Barr virus, cytomegalovirus, herpes virus. These are viruses that can non-specifically infect the liver. But من نقول احنا viral hepatitis احنا نقصد or mainly we are pointed toward hepatotropic viruses called hepatotropic viruses that are viruses that have a special propensity to infect hepatocytes called hepatotropic viruses. These are hepatitis virus A and E that are transmitted by fecal-oral route of transmission, and hepatitis or hepatitis B, C, and D, and that are transmitted by parental routes, whether blood-induced or vertical transmission from the infected mother to the fetus, and so on. The signs of or clinical presentation can be asymptomatic or for each type can be associated with malaise, weakness, nausea, and anorexia. And also there is an elevation of hepatocellular enzymes that are alanine transaminases and aspartate transaminase. شباب بس سؤال هذا these enzymes alanine transaminase and aspartate transaminase, these enzymes indicate what? These are an intracellular enzymes. When there is elevation of these enzymes, it indicates any idea إذا أحد عنده؟
liver damage.
Yes, hepatocellular damage indicate when there is elevation of these two enzymes, it indicates hepatocellular damage. Serum alkaline phosphatase, this is a biliary canalicular enzymes that are mildly elevated in viral hepatitis, mainly elevated in biliary tract disease. Okay. Hepatitis A virus, قلنا hepatitis A virus is called also infectious virus. ليش نسميه infectious virus? Because it's transmitted by fecal-oral transmission, contaminated food or water, and water in low level of hygiene and sanitation, and can be mild or asymptomatic and mainly affecting children. And this virus is very common, and it is forming up to 25% of acute hepatitis. كل الهepatitis or hepatotropic viruses are RNA viruses ما عدا hepatitis B virus, which is double-stranded DNA virus. زين. Hepatitis A is an RNA enterovirus, picorn group. Incubation period is of 2 to 6 weeks, followed by fever, malaise, and anorexia, and jaundice. That is appear 1 week later and last for 2 weeks. Fecal shedding of the virus in the stool started 2 to 3 weeks before and 1 week after the onset of jaundice. 2 to 3 fecal shedding of the virus, 2 to 3 weeks before and 1 week after the onset of jaundice. So it is acute, and lifelong immunity will be conferred. Hepatitis A virus never causes chronic hepatitis or carrier state. Specific antibodies will be detected of the IgM type, will be detected at the onset of symptoms. It is a marker of acute infection. Hepatitis A virus IgM, and few months will be declined and replaced by IgG antibodies that give immunity against reinfection. And this is the importance of vaccination. Viral shedding in the stool will be stopped with the rise of IgM titer. Cytotoxic CD4 T cells are important in hepatocellular injury. This is a cut section or gross section of a swollen liver, and here foci of congestion or hepatocellular necrosis are seen, and according to the severity of the pattern of hepatotropic or viral hepatitis. Portal inflammation as you remember in the previous slides, only few scattered lymphocytes are seen within the portal tract. Here, the portal inflammation is very prominent in viral hepatitis. This is the portal vein, which is congested, and even there is congestion of hepatocellular sinusoids. This is the bile duct, this is the duct, and this is the artery, and very prominent lymphocytic infiltration. Even acute cells can be seen in acute viral hepatitis. This is called mild thyroiditis or portal tract inflammation. Inflammation is limited to the portal tract and not spread to the trabeculae. This is a more severe infiltration pattern of hepatocellular inflammation and infiltration of the portal tract. This is the limiting plate. قبل شوي قلت لكم limiting plate. Delicate stromal fibers are separating the portal tract content from the adjacent hepatocellular lobule in zone 1. Then this is called the limiting plate, مثل السياج, مثل الحاجز, separating the portal tract content from the adjacent hepatocytes. Disruption of this plate here, the black arrow pointed to, the disruption of this plate here on the right, on the left side, is a sign of important sign of chronic hepatitis and distortion of the disruption of the hepatic lobules, in which the portal tract infiltrate will be spill over into the adjacent hepatocyte and disrupt the limiting plate. This is a table to show you the types of hepatitis, hepatotropic viral infection, and courses: hepatitis A, B, and C. Transmission, chronic hepatitis, no chronic hepatitis in A, and only 5% will passes into chronic, and more than 85% hepatitis C passes to chronicity. Fulminant hepatitis is seen in, can be seen in small percentage, especially in pregnant women or certain type of lower immune people. Carcinoma is more common in hepatitis C and B, more common in C. No risk of carcinoma for hepatitis A. Vaccine is effective for B and even A. More still, there is liver transplantation is the treatment of choice for many chronic and complicating hepatitis C viral infection. B, hepatitis A is a self-limiting or benign course, or and hepatitis B, most of the